Welcome back, guys. Now let's see what are the abnormalities. Okay, for example, if there is any lesion in the optic chiasm. Okay, now here please look at here. Now if there is any lesion in the optic chiasm, which fibers will be affected? We have already discussed. In the optic chiasm there is a crossing of the nasal fibers. So the nasal fibers will be affected in the optic chiasm. Okay, now if you compress the optic chiasm, the nasal fibers are damaged. Now we have seen, now this nasal fibers, okay, this nasal retinal fibers, they are looking at which vision? The nasal fiber, the nasal retina is looking at the temporal visual field. So if there is any damage to the optic chiasma, the nasal retinal fibers are affected. If there is any damage to the nasal retinal fiber, the person is going to lose which vision? The person is going to lose the temporal vision. So the person is going to have vision something like this. Okay, he is seeing normally the nasal vision is okay, the nasal vision is okay, but the temporal vision is lost on both the sides. The person cannot see the temporal vision. So if there is prolactinoma, prolactinomas are the macroadenomas, prolactinomas are the macroadenomas of the pituitary gland. Now here is the pituitary gland situated. Okay, in this place pituitary gland is situated. Now because of this tumor, space occupying lesion, now this tumor is going to compress the optic chiasm. And the optic chiasm is compressed. A simple thing, nasal retinal fibers are damaged. Now whenever the nasal retinal fibers are damaged, the patient is going to, okay, this person is going to lose the vision on both the eyes. In both the eyes, the two temporal vision is lost. So this condition is called as a bitemporal hemianopsia. Bitemporal hemianopsia is seen. So bitemporal hemianopsia is due to the loss of nasal retinal fibers, or due to the damage at optic chiasm. Okay, optic chiasm. Now after this, let's discuss about the lateral geniculate body. Simple. Optic tracts, they will go to the lateral geniculate body. Now in this lateral geniculate body, what happens? First of all, this lateral geniculate body is divided into how many layers? It divided into 6 layers. There are 6 layers in the lateral geniculate body. Now how to understand this lateral geniculate body? Into this lateral geniculate body, there are inputs present. Okay, see here are the inputs. And from the lateral geniculate body, there are outputs coming out. Outputs. So input is there, output is there. Now we have to understand what are the input fibers and what are the output fibers. Now see layer number 1, 4, 6. Okay, the layer number 1, 4 and 6 receives the information from. Now just look at the layers. Now see this layer number 1, this layer number 4 and layer number 6. They are receiving these dotted fibers, right? Okay, they are receiving these dotted fibers. Now what are these dotted fibers? From where they are coming? Please look here. Now here is a dotted fiber. Okay, so dotted fibers are coming from the opposite eye. See, now from here, this is the nasal retina, right? This is the nasal retina. Now we all have discussed the nasal retinal fibers will cross to the opposite side. See, this nasal retinal fiber, it is crossing to the contralateral side. Okay, true. This nasal retinal fiber, it is going to the lateral geniculate body. Okay, to which layers? Layer number 1, 4, 6. So the layer number 1, 4, 6 receives the nasal retinal fibers from the contralateral eye. Okay, well and good. So layer number 2, 3, 5 receives from, like, which eye? So the layer number 2, 3 and 5. Layer number 2, 3, 5 receives the fibers from, see, this 2 is receiving the straight line, straight nerve fiber. 2, 3 and 5, they are receiving the nerve fibers or neurons from the ipsilateral temporal retina. So now in this lateral geniculate body, layer number 1, 4, 6 receives the nasal retinal fibers from the contralateral eye, but layer number 2, 3, 5 receives the ipsilateral temporal retinal fibers. Okay, so this is the input. So we have discussed about the input. Simple input is completed. Now let's discuss about the output. Now output is, see, layer number 1 and layer number 2. See, they are forming this pink color fiber. They are forming this pink color output. And layer number 3, 4, 5 and 6. From here, this green color neurons are coming. Okay, see, I'm just like, the neurons are not going to be in green color. Just for your understanding purpose. See, from here, this green color nerve fibers are coming and they are forming one output. So layer number 1 and 2, it forms one tract which is called as, okay, it is going to form magnocellular pathway. Okay, magnocellular pathway is the output from the lateral geniculate body. Magnocellular pathway is coming from layer number 1 and 2. And layer number 3, 4, 5, 6 forms the parvocellular pathway. So parvocellular pathway is coming from layer number 3, 4, 5 and 6. Okay, now we'll get it out. Sir, what is the function of this magnocellular pathway and parvocellular pathway? See, this magnocellular pathway and parvocellular pathway, they are nothing but the geniculocalcarine tracts. These are the geniculocalcarine tracts. Okay, now which type of information is there? Absolutely visual information is there in this tracts. Visual information is going to the occipital cortex. But which type of visual information? That's important. The functions of the MLP means magnocellular, sorry, this is not MLP, MCP, magnocellular pathway. The functions of the magnocellular pathway is magno for movement, remember M for M. The magnocellular pathway is taking the information about the movement. If someone is moving in front of me, now that movement information, moments are captured and the movements are going through the magnocellular pathway. Okay, now movements, flickering, light flickering, okay, light flickering and the depth. Depth is the 3D vision. Okay, 3D vision or the stereopsis. I can say that, like, this table is in front of me, back to the table there is camera, back to that there are chairs, something like that, there is a wall. So I can feel the depth. It's not like a 2D vision. So the image which you see in the phone, that's a 2D vision. You cannot feel the depth. But actually you can feel the depth. Okay, normal vision is the 3D vision. You can feel the things. Okay, someone is front and back to it, who are there? Okay, that's the depth vision or called as a stereopsis. So this depth vision is also going, this information is also going through the magnocellular pathway. So which information is going via the magnocellular pathway? About the movements, flickering and 3D vision, depth. Now which type of visual information I should say. Which type of visual information is going through the parvocellular pathway? It is the fine details. Okay, color vision and the texture. I can feel this, the table is soft. Just by looking at the wall, I can feel that the wall is rough. So the texture, the color details, fine details are going through the parvocellular pathway. So both magnocellular pathway and parvocellular pathway, at the end of the day, they have to go to the primary visual cortex, area number 17, occipital cortex, which is called as a calcarine sulcus. Okay, so information is going there. So in the calcarine sulcus, now the person is forming the images and the visions are going to be analyzed. After this, now let's discuss about the pupillary light reflex. Okay, pupillary light reflex, which is under the control of parasympathetic nervous system. Now, what is this pupillary light reflex? Very simple. In your exams, what they are going to ask you is what are the afferents, what is the center, and what are the efferents. Now, please look at here. Pupillary light reflex means, okay, pupillary light reflex means when you put light into one eye. Okay, you are keeping the light into this eye. When you keep light into this eye, what will happen? So when you are putting torch into this eye, immediately meiosis will happen or mitosis will happen. Immediately meiosis will happen. The pupil is going to constrict. Okay, the pupil is going to get constricted. Now in this eye, if you put light means the pupil in this eye will be constricted, parasympathetic activity. In the same way, the pupil is going to be constricted in the contralateral eye also. So in both the eyes, pupil will be constricted. Even though you are keeping stimulus in one eye, in both the eyes pupil will be constricted. If all this tract is intact, if there is no lesion, if all this tract is intact, if all this pathway is intact, even if you put light in one eye, the opposite eye, the pupil is going to be constricted. Meiosis will happen. This is called as a pupillary light reflex. Now let's see what is the pathway. Now whenever you put the light into this eye, that information is going via the optic nerve. Via the optic nerve, that information will go. Okay, via the optic nerve, via the optic tract, that information will go to the center. Now who is acting as a center here? The center nucleus, the center for this reflex is called as the pretectal nucleus. Here is a pretectal nucleus. See, now if you put light in this eye, retina is activated, optic nerve is activated, optic tract is activated. Now this information at the end of the day, it have to go to the pretectal nucleus. What this pretectal nucleus is doing? Now this pretectal nucleus will activate whenever you have light, okay, light focus into your eye. Now this pretectal nucleus is going to activate a parasympathetic nucleus called as the Edinger-Westphal nucleus. Okay, here are the Edinger-Westphal nuclei. Now please look at here, this pretectal nuclei, it is having connections with both the Edinger-Westphal nucleus. Now if you activate this pretectal nucleus on the left side, for example, it is going to activate the Edinger-Westphal nucleus on left side as well as right side. Now if you activate this pretectal nucleus, it is going to activate the Edinger-Westphal nuclei, the parasympathetic nuclei on both the sides. So even if you put light in one eye, both the Edinger-Westphal nucleus are activated with the help of pretectal nucleus. Now see, you put light here, optic nerve activated, optic tract activated, lateral geniculate body, and at the end pretectal nucleus is activated. Once the pretectal nucleus is activated, Edinger-Westphal nuclei are activated. Now what happens? So these Edinger-Westphal nuclei, see, they are giving the parasympathetic neurons. Okay, these parasympathetic neurons are coming out. Now these parasympathetic neurons are coming via the which nerve? These parasympathetic fibers, they are going to jump into the oculomotor nerve. Okay, see, these parasympathetic fibers, they will come via the oculomotor nerve, which is the third cranial nerve. This is the third cranial nerve. Okay, this is the green color thing which is present outside. This is not optic nerve. See, this green color thing is the oculomotor nerve, which is the third cranial nerve. See, in the third cranial nerve, these parasympathetic fibers are present. Okay, now these preganglionic parasympathetic fibers, these are the preganglionic parasympathetic fibers. These preganglionic parasympathetic fibers, they will come to ciliary ganglion, and the preganglionic fibers are terminated there, and from there the postganglionic fibers are originated. Now from here the postganglionic fibers, see, they are coming and going to the pupil. They are going to the constrictor pupillae muscle. So the constrictor pupillae muscle will be activated in both the eyes. So there will be constriction of the pupil. So meiosis will be there. Okay. So information is going via the optic nerve, going to the center. The center is the pretectal nucleus here. Once the center is activated, the efferent, the output is coming via the oculomotor nerve. So efferent is the oculomotor nerve, center is the pretectal nuclei, and afferents are the optic nerve. So this is how the pupillary light reflex happens. Hope the video is helpful. Okay, with this we have discussed about the special visual sense. Okay, all the things which are needed for your exam, all the things are discussed. Hope the video is helpful. In the next video, we will discuss about the second important, okay, special sensation, that's the hearing. Thank you.